Are you traveling for work? Are you traveling on vacation? Are you going camping? Or are you going alone or with a family and friends? If you are one or all of the above, you need to have it on you. It is your travel pharmacy bag, or what I like to call it, pharmacy kit. I'm Henry, and now listen to Wasim.
So I'm Wasim, and as a pharmacist, also as a safety expert, I will give you all tips you need to build your travel pharmacy kit, which will keep you safe and be able to deal with the most medical condition you may face when you are on move. We will guide you in this video to how exactly pack your travel pharmacy kit. So listen.
So, first of all, you need a bag with different compartments, like this one. Use food bags or Zippo plastic bags to develop your kit. Make a list of inventory of all items on the kit. You can download our list in the description below. This is a basic kit, and we will have another video to guide you how to pack a more professional or advanced one. Also, pre-travel preparation is really important. You should check for necessary medication and vaccinations for the country you're going to.
Exactly. So the pharmacy kit consists of 5 main compartments. Part 1 is documents, part 2 is medications, part 3 is hygiene kit, part 4 is skincare kit, part 5 is the first aid kit. To start build your pharmacy kit, you should have all of those parts together. In this video, we'll just cover the first 2 parts, so the documents and the medication. The last 3 parts we will just cover in next video.
For the documents, you should definitely always carry a copy of your name, address, and the contact person in case of an emergency. Secondly, a copy of your vaccination book. Thirdly, a copy of any medication plan or medical conditions. Fourthly, a copy of your known allergies. And lastly, a copy of organ donation documentation. If there are no medication plan, no known allergies, no organ donation documentation, you should still write it down that there are none.
Part 2, medication. In this part, we have 3 subparts. First one is your personal medication. Second one is protective medication. And third one is case-based medication. Back to your personal medication. If you having any medical condition or emergency condition that occur suddenly, like an asthma, or if you are taking consistent medication, you should consider the following. First of all, put extra medication enough for extra 2 days. Second, don't forget to back up your medication for the whole period of traveling, plus by 25%. So, an example, you are traveling for 10 days and you are taking 1 tablet per day. So, 10 plus 25%, it's 12.5 tablets. Basically, you are packing 13 tablets. If you are traveling between time zones, think about time shifts to not miss or overdose your medications.
Coming to the second part of medication, the protective medication. First of all, there's the muscle support. So in some cases, you will do more muscular activity and your muscle system will be used not in its normal level. We recommend magnesium, 400 milligrams once a day. For the immune support, so during your travels, your immune system might be overwhelmed. So we recommend to take zinc and vitamin C to support the immune system. For the fluids and electrolytes, especially when you travel to hot areas, we recommend to take electrolytes every 2 days.
So the part 3 of medications are case-based medications. So statistically speaking, the following are most cases that you may face if you are traveling. The other cases, it's personally also geographically dependent cases, which we will discuss in the next videos.
The most important case medication are painkillers. It is recommended to have these following painkillers with you in your travel pharmacy kit. First of all, paracetamol. If you have a headache, for example, ibuprofen is for stronger headaches and other kinds of pain. Diclofenac gel is for local pains, Buscopan for stomach cramps, naproxen for monthly period pain. Then we have the anti-diarrhea medication, especially loperamide as a sublingual tablet to stop the diarrhea, but you may only take it when there is no fever involved. Then we have the minerals and electrolytes also for diarrhea to substitute, as we already covered in the protective medication. And also there is the anti-constipation medication, for example, Macrogol. It is recommended if you have a constipation for more than 3 days.
New point on the list, anti-nausea and anti-vomiting medications. Dimenhydrinate, it's recommended to have 30 minutes before travel. If you have motion sickness, don't take it if you are driving. We have tablet and chewing gum forms. Next point is anti-acid or anti-stomach pains. you can pack Gaviscon liquid or a tablet of omeprazole if you have heartburn symptoms. Next point is sleeping pills. We have doxylamine, which you can take it 30 minutes before going to bed as a tablet form. Another option is melatonin as a drops or tablet forms. Anti-allergica, it's very important to have it on your travel pharmacy kit. We have cetirizine or loratadine as tablets or syrups. We have phenystyl gels, hydrocortisone gels. You can apply it directly after you are exposing to an allergen.
The next point is medication for anti-flu symptoms. There are anti-congestants as a nasal spray, for example, xylometazoline. We have paracetamol and ibuprofen for fever, but of course we mentioned that before for painkillers as well. There are lozenges for throat pain, either plant-based for milder throat pain or, for example, flurbiprofen for stronger throat pain. Then we have cough medications, for example, Ambroxol as a reliever and dextromethorphan for a suppressant. And lastly, for sore and irritated eyes, there are lubricant eye drops with hyaluronic acid.
Now we came to the end of this list. Other case medication depends on your personal experience. So if you are traveling a lot and facing special condition, for example, intim fungal infection, you should consider adding those medication against this case to your medication kit. Just to show you how you can back your travel pharmacy kit. For example, I have all my medication for a special case in one bag. Then I have other case medication in another bag. I have my protective medication in this bag. And I have, for my kids, for example, I have an extra bag where I put like special medication only for my kids, and also my personal medication in other compartments. So every compartment have a separate medication. So it can be easy to be recognized, and it's be easy to be taken in case if you just like you are hurry and you need your medication.